Today we are going to discuss if peritoneal dialysis is permissive of traveling. For those who tune for the first time, I am Dr. Francisco. I am a specialist nephrologist and a transplant immunologist working at Francisco Kidney Medical Center in Singapore. This is the bite-sized information for kidney and related diseases. This video blog is destined to help patients or their relatives, patients with kidney problems or at risk of kidney problems, to understand their diseases better so they can take better care of the diseases together with their own doctors. Why? To minimize their worries and minimize complications so they can live a better life despite having kidney disease. So the topic of today is, can you travel while undergoing dialysis? The simplest answer is yes. As we discussed before in the previous video regarding if you can travel while having hemodialysis, it is important, and because also applies to peritoneal dialysis, that first of all you need to check whether there is any travel restriction in your country and in the country you're planning to go, including any quarantine orders, before you plan your travel. As I mentioned, peritoneal dialysis is indeed a therapy that doesn't forbid you to travel. As you know, peritoneal dialysis, for the people who is doing it, but for the people who is not doing it, peritoneal dialysis can be done manually or using a machine when you are sleeping. When you travel, it will be very difficult that you will be using the machine technique. You will be doing probably the manual technique at the comfort of your holiday home or a hotel. Why you can do it yourself and why is this simpler? Because peritoneal dialysis is a do-it-by-yourself therapy, a self-care therapy. You are typically the person doing it, or someone like a caregiver, relative, or nurse can do it for you, but is you or someone close to you who does the therapy. But that gives you some independence when you are traveling. You don't need to depend on a hemodialysis center schedule like if you were to have hemodialysis. So I mentioned again, being a self-care therapy is very important, and that also facilitates traveling. But you need to be actually trained and empowered in doing the manual technique with confidence. Indeed, being a self-care technique and do it by yourself gives you certain freedom. You can decide the timing, the place to perform the therapy. You can manipulate the schedule. When you are overseas, you might want to do it a few hours earlier or later, or after coming back from a trip or a business meeting, etc. The problem with peritoneal dialysis is that it needs to be done daily. So in a way, you bring that chore to your holiday or to your business trip, or for whatever reason you're traveling there. But if you are already on peritoneal dialysis, obviously that is, you're very used to it, so it should not be any problem, especially if you are using the manual technique, because you most likely will be using the manual technique. But can be an issue for people who are doing the machine technique, that they need to convert to the manual technique. It's just a matter of adapting to that situation, understanding that it's a traveling, you need to do it. But it can be an extra hassle requiring your adaptability and move your plans around that. But because you might be in a foreign environment, not necessarily foreign for being in an overseas country, but just something not familiar to you, you might be concerned about contamination and some infection risks. contamination of the peritoneal dialysis system, and maybe you will be worried about doing some, having an accident and mishaps with the connection, etc. Especially when you're doing an unfamiliar environment, you don't have all the things in the same place as you normally have in your home. So you just need to be careful. But then you need to be trained. People who do the machine one have maybe never done the manual one, so then it's idea that they get a training or a refresher on the manual technique before going on holiday to avoid any mishap and risk for infections. So you take the best precautions properly. Just contact your care team, and then they probably can give you a refresher course on that, or train you if you are not even trained, or if someone is going to help you, that person should be trained also by the care team and not necessarily be trained by you, because at the end of the day can be some misunderstandings. It's better that you get trained, or the person that is helping you is trained by your medical or nurses team, so you can really minimize the chances of infection. Because you indeed need to take all the same hygienic precautions, and even more, ensuring that the room is clean and you're in a comfortable environment, and taking good care of your exit side, so that you can enjoy your trip when you are overseas. If you're on holiday, or taking care of some businesses, etc. So you have the less concerns and worries. Many vendors of peritoneal dialysis can deliver dialysis fluids and sometimes other equipment to those foreign addresses or to your hotel. So you don't need to carry with fluid bags, which will be very heavy, especially if your holiday is prolonged, which then could be a big hassle or can be a deterrent to travel to many people. So the vendors have that, they can help you in that way. You just need to contact them to arrange that. However, with the COVID-19, the situation might have changed, and maybe some vendors have some traffic restrictions between the employees themselves, or with traffic restrictions in their products. So you need to double check that. Don't assume that their business will be running as per normal as before. So to avoid any disappointments, or suddenly you are in limbo with in a foreign country with no equipment to get your dialysis done. So I need to mention something again, similar to hemodialysis. Many people also undergoing peritoneal dialysis would like to shorten the treatment duration, or the number of treatments per day, or even missing one session, what we call one bag, or even the whole day, or sometimes even more, or no dialyze at all for a very short trip, to minimize hassle, to save money, to gain time, and to avoid risk of infection, because they are doing it, as I mentioned, in an unfamiliar environment. I do understand those reasons, but again, missing dialysis is always not safe, especially in an unfamiliar foreign country, and perhaps in holiday mood, eating and drinking more than usual, maybe requiring, extra removal of substances and water. So please aim to continue with your therapy as best as you can. But true, if for whatever reason you miss one single session, one bag, or you delay it a little bit, most likely nothing will happen if it is just one off. But also depending on your condition, at the end of the day, you know yourself better. And if you have any curious about that or hesitations, just ask your dialysis nurse or your doctor. In Francisco Clinic Medical Center, we advise our patients and the relatives on those travel preparations, mainly from the medical point of view, not for the actual traveling. We're not agents, yeah. And we can answer all the questions because we know how important traveling is for someone's lifestyle and enjoyment of life. So if you need our help in more detail, you can contact us. I'm happy to take any questions. There's someone, Chris Jones. I will wave. Hello. If there is any question, you can put it now in the comments. If not, you can put it later on the replay. And so that's it. So if no questions, no worries. So I'm Dr. Francisco, wishing you the best possible health. Take care. Bye-bye.